Hello, everybody. I am Dr. Niraj Kumar Singh, and I am an associate professor at the Department of Audiology, All India Institute of Speech and Hearing, Mysuru. So here we are in the month of September, a month known for monsoons, lush greenery around us, and the beginning of festivities all over the country. But that is not all the month of September is known for. Every year, this month also witnesses the celebration of Balance Awareness Week. And in this year, that is in 2024, this week happens to be between 15th and 21st September. Have you ever wondered how are you able to stand, walk, run, or perform different activities without ever falling? Your inner ear, the eyes, that is your visual system, and the muscles and joints in our body combine together. They send signals to the brain, and brain combines these signals to help us stay balanced. The inner ear has got 2 otolith organs and 3 semicircular canals. These are tube-like structures. The entire inner ear is filled with fluid. Only in the otolith organs, there are otoconia particles. The otoconia particles are small stone-like crystals and present only in the otolith organs. They are not present in the semicircular canals. When for some reason, these otoconia particles get dislodged from the otolith organs and they happen to fall into the semicircular canals, this leads to a condition called as BPPV. BPPV is an abbreviated form that describes benign paroxysmal positional vertigo. The word benign means that the condition is not progressing and it's not going to become life-threatening. The word paroxysmal means that each episode is going to be only transient, that is going to last for only a few seconds to maximum a minute or two. The word positional means that the vertigo is going to be provoked by your change in positions. For example, if you are sitting up from a lying down position, or if you are sitting up and go to a lying down position, or if you're rolling in the bed, or bending down, turning your head left or right, or looking up, any of these can produce the symptom of vertigo, which is the true spinning sensation. So that means a person with BPPV will have a transient vertigo, which will be initiated by the change in position. So each time the person changes position, the vertigo will appear and it's going to be lasting for a very short duration. Generally, females are 3 times more at risk than males for getting BPPV. Older adults are also at higher risk for getting BPPV than younger adults, but it does not mean that a young child or a young adult will not have BPPV. A lot of times people experience BPPV after they have encountered a fall. Women after their menopause also experience BPPV-like symptoms. Migraine can be one of the causes of a secondary BPPV. High blood pressure, high cholesterol levels in the blood, other ear surgeries, and some of the diseases affecting the inner ear can also be causes for BPPV. When you experience symptoms like BPPV, you need to either visit an audiologist or an ENT doctor who's been trained in the assessment and management of vertigo. Normally, these professionals will take you through a series of head and body positions. They may just look at your eyes, or they may put a goggle on your eyes and look at the eye movements in a video monitor. BPPV typically presents with a particular pattern of eye movements. These eye movements are called as nystagmus. So depending upon the kind of nystagmus that the ENT doctor or the audiologist observes, he or she will classify it as a posterior canal BPPV, or an anterior canal BPPV, or a lateral canal BPPV. The diagnosis is important because the treatment varies. Here I show you glimpses of a few diagnostic and treatment strategies that an audiologist or an ENT doctor may use. Here you see me doing a maneuver called as a Dix-Hallpike test. Here I make the patient lie down on the bed with the head extended beyond the table and watch for the eye movements and then make him sit up straight. The same is performed with the head turned to the right side. Depending upon which position produces vertigo and nystagmus and what kind of nystagmus is produced, I will be able to make a diagnosis. This test is typically used for the diagnosis of a posterior canal BPPV or an anterior canal BPPV. Here I make him lie down to the lateral side and then after some time turn the nose downwards and then make him sit up straight. This is called as a Goffoni maneuver and it is used for the treatment of lateral canal BPPV. Person experiencing symptoms like BPPV, do not panic. That's the first thing you need to remember. But you also need to remember that vertigo, which is initiated by changes in the head and body positions, although less often, may be seen in cases with stroke or other neurological diseases. How many ever videos you may have watched on YouTube? There are plenty of videos on YouTube which show different diagnostic and treatment maneuvers for BPPV. However, do not try them yourself at home. You might be doing more harm to yourself than actually help yourself. Seek professional help as often and as soon as possible whenever such symptoms arise. Remember that vestibular symptoms are invisible and often unpredictable. They can come without any warning signs. And therefore, when you do have vestibular symptoms, seek the help of right professionals. Thank you for watching this video. Have a good day.